Hey guys, welcome to the fourth season of Health or High Water. I've got a really excited episode here. I have Dr. Mark Hynx here talking about feet, podiatry. We're going to get into diabetes a little bit here. Found Mark on LinkedIn. We found each other, and he's got a very similar goal of just trying to help people and getting out there, spreading the word. I'm really excited to have him on today. If you guys have not subscribed to this episode or these podcasts, make sure you guys do. Every little bit helps. But Dr. Mark, how's it going, man?
Hey, Tripp, good afternoon. Thank you for the privilege of being with you today.
Well, so for the audience, we tried this yesterday, and I live in what we call a bucolic location, and our internet's not what we call reliable. So we had a little bit of an issue, but Dr. Mark was super patient with me and rescheduling. So thank you so much for making this work a second time around, man.
It's important, I'm grateful for the opportunity.
Well, we in our small time talking yesterday, there's a lot of people that are affected with diabetes, right? You said something. I said 10%. You corrected me with 11%. And that's even more than my original estimate and my research on what I was doing. And you've got an esteemed background all the way from the 70s, owning your own practices. You're in medical journals right now. You've been on board of directors for certain things. Can you give the audience a quick background of who you are and how you got to where you're at right now?
Sure, thanks. I started out in Cleveland, Ohio, going to podiatry school and came to Miami, Florida to do my surgical residency. Stayed in Miami. There could be worse places to be. I stayed in Miami for about 20 years. And in 1993, I believe, Hurricane Andrew came to Miami, and that was the reason that I left. In one night, I lost my medical practice, my home, and all of its contents. So it was a wake-up call. I ended up taking a position with the Department of Veterans Affairs Medical Center in Salem, Virginia, in the Blue Ridge, which was a terrific place to go. Not as cosmopolitan as Miami, but still a nice place. And then I stayed there 5 years, and then had an opportunity to come to Nashville to be the chief of the podiatry department, and probably more importantly, the chairman of the Preservation, Amputation, Care, and Treatment Program.
So a lot of your work has been dealing with trying to prevent things like amputations, correct?
Yes. Yes.
So with your work with, what over 10% of the population having diabetes and loss of limbs being a risk, what got you into this specific niche and what are you trying to accomplish with it?
Well, the position that I was given really made me focus on, the diabetic foot, although I'd been treating people with the foot health of people with diabetes for many years. There are 500 million people on this planet who have diabetes and 500 million who have prediabetes. And that number is going to double within about 10 to 15 years. And, when you look at the numbers, the single most costly, debilitating, and deadly diabetes complication, which is responsible for infections, hospitalizations, amputations, and in some cases, premature death, is a diabetic foot ulcer. So, I had been charged with running this program to see if I could prevent people from losing legs. And, the more that I worked in it, the more people that I met, the more tragedies I saw. Now, we didn't lose everybody, and we didn't lose, we healed quite a few of them, but the ones that we lost were really devastating. I would work for months and months with people to get their wounds healed, and then they would die. So, I thought to myself, there's got to be a better way. We are not doing the best service for these people. So I decided to take a look and see what the opportunities would be to change the paradigm a little bit and try to become more proactive and try to screen people and find out what their risks were so that we could prevent, the tragedies that I was seeing. And as I did that, I was, much more successful. Patients were happy and I felt, very satisfied.
Well, I think it's really noble work too. There was a doctor back in, I think, the late 1800s, early 1900s, and he was like, "Hey, I'm not killing babies because I'm washing my hands,"
Mm-hmm.
right? And
Mm-hmm.
then they threw him in jail. So
Medicine's had a hard road.
it's had a hard road, but what's kind of like a light at the end of the tunnel, and thank God it's not a train, is people like you going out there and thinking, what are these factors going into it? Hey, listen, how can we prevent this from happening? Because there is a huge psychological factor that goes into this, a physical factor, and then one of the big things that hits family is a financial factor that goes into everything that goes with diabetes, the amputations, medicine, all that kind of stuff. It's nice to hear that you're taking that step forward to help a huge part of this population. And on that, and speaking on that, what are some of the major risk factors you're finding that are leading to these extreme cases?
Well, if you understand what happens here, you'll understand how to prevent what happens. People with chronically elevated blood sugars develop uh, peripheral arterial disease. And the smallest little vessels are called arterioles, become either narrowed or closed. And these vessels are found in the feet, the eyes, the kidneys, and the heart and the brain. And so the complications that we see in people with diabetes who run chronically elevated blood sugars are foot wounds, amputations, blindness, renal dysfunction leading to the need for renal dialysis, heart attacks, and strokes. It's very interesting, Tripp, because a recent study showed that most people with diabetes do not understand how this happens. And when you have peripheral arterial disease, nerves that depend on these small little arteries for their fresh oxygenated blood and nutrients do not receive it. And so you have a secondary problem, which is called neuropathy. And neuropathy has three flavors, if you will, three subcategories: sensory, motor, and autonomic neuropathy. Sensory neuropathy is where a patient loses their ability to feel pain. And so that leaves them vulnerable to three kinds of trauma: mechanical, chemical, or thermal trauma. Motor neuropathy causes uh, difficulty in walking and falling and some deformities of the feet. And autonomic neuropathy affects the automatic uh, functions in the body. And in the lower extremities, that causes dry skin, cracking of the skin, and fissures, which can become portals of entry. So, one of the easiest things to do is to just take a few minutes and discuss these things with people who have diabetes. And I like to empower them to say, look, this is what your risks are, and this is what you can do for yourself so you can protect your health and live a good quality of life.
That's a great answer. And we have to understand what's going on to figure out how to fix it. And I don't think a lot, like, I'm so glad you explained it, because I'm sure I didn't know, and I'm sure most of the audience didn't know at all either.
Yeah, there have been surveys where patients have been surveyed and they just do not understand the physiology of what's happening. But I also want to give you a little information to give you kind of a better sense about what this is. Worldwide, someone develops a foot ulcer every second.
Second.
Every second. And worldwide, there's an amputation every 20 seconds. So in the last minute that we've been talking, there have been 60 ulcers and 3 amputations. And to treat an ulcer costs about $44,000. So do the math. It's a huge amount of money that we're spending on this. About 20% of all people with diabetes will develop a foot ulcer in their lifetime. So let's just take 20% of 500 million. That's 100 million people.
Yeah.
Are going to have an ulcer. And then let's take that a little further. 85% of all lower extremity amputations in the diabetic population are preceded by an ulcer. So understanding these gives us a better idea about how to prevent them. Now, 38% of the people who lose a leg are going to lose the other leg in 3 years, and 75% of the people who lose a leg will not survive 5 years. So this gives you some indication about how deadly this situation is. It's just not, a garden variety thing that should be taken lightly. So the point here is that the mortality that's associated with a diabetic limb amputation is greater than all forms of cancer combined, excluding pancreatic and lung cancer. Now, I've painted a really bad picture here, kind of an ugly picture, but I want to kind of balance it out a little bit. And what I want to say is this, okay? If we understand where the trapdoors are, where the problems are. That gives us an opportunity. And that opportunity is, let's screen patients. Let's find out what each patient's unique risk factor is for developing that foot ulcer, because we know assuredly that if you prevent the foot ulcer, you prevent the infection, the emergency room visit, the hospitalization, the amputation, and in some cases, premature death. So the focus here is we need to identify which people have risks that would lead them to get a foot ulcer. And when we can identify those risks, we can then educate the patient, and we can refer the patient to members of what we call the interdisciplinary team, so that each individual risk can be mitigated. What we're doing now has a lot to do with the business model of medicine, and I'd like to talk about that for a second.
Yeah, go for it.
It's very integral to why people are getting these problems. And it's not just ulcers; it's going blind, needing dialysis, and all the rest of it. There's two business models in the United States. One business model is called fee-for-service. And this is probably the predominantly business model. And when I was in practice, I used the fee-for-service business model. And that means that everything, when you come into the office, everything we do, we're going to find a billing code and we're going to bill for it. So the office visit, the x-ray, if I gave a cortisone shot, or if I debrided a wound or whatever it was, we would bill for it. In the fee-for-service business model, the doctor needs you to be sick. If you're not sick, you're not coming in. And if you're not coming in, they're not making any money. So as a corollary to this, there's very little emphasis put on prevention and patient education. And this is kind of where the train's kind of going off the tracks, if you will. However, there's an alternative to it called value-based care. And right now the market is about 29 to 30% value-based care, and it's growing all the time. Value-based care is 180 degrees away from fee-for-service. It's kind of a modified capitation kind of a experience where, like in Medicare, the government will give a group of doctors a bucket of money for each patient, and that's all the money you're going to get to take care of that patient for a year. And there are 12 or 13 different deals. But the idea here is that the emphasis is on financially incentivizing the doctor to take good care of this patient, because they get paid more if they keep the patient healthy.
Right.
If there's money left over at the end of the term, it's theirs. So this is where prevention and education really are critical, because it's going to make the difference between a patient, having an ulcer or having a heart attack or needing dialysis and having better health. So the business model has a lot to do with how patients are treated.
You're explaining things really great. We're gonna have you back on just to let's have the voice of reason or something, But just talking preventively. So myself, I'm a genetic-based program designer. So I figure out your health and wellness programs based off of DNA. Hey, what's your CLL5A1 risk for Achilles ruptures and tendinopathy, those kind of things. Are you guys using tools like genetic testing? I know there's a called 5YAR that's directly correlated with type 2 diabetes. Are you using tools like that at all?
I haven't been involved in any genetic testing. There's so much happening so quickly in the world of medicine. And I retired in 2019. I'm just going to have to say I probably would have done it if I was still practicing, but right now, no, I haven't used it.
Well, it is so new too, and I was on the phone today trying to present this health profiling process I got for using DNA testing to help with insurance. Hey, if you're healthy, pay a lower premium. If you're out of shape, what have you. But it's still such a new thing that no one's ever programmed off of DNA health and wellness programs. I'm one of the first ones, so I know it's kind of a shot in the dark with that. But do you notice more amputations with type 1, type 2? Are there certain ones at more risk?
Yeah, it's a good question. I think people with type 1 get a little bit more attention, a little more love. Typically, it tends to happen in younger folks. And so, there's probably a little bit more energy and effort for them. Type 2 is more of a kind of a social problem of overeating, not enough exercise, bad lifestyle, you know. But I tell you what, if we could give four core messages to people with diabetes to help them to prevent an amputation, I want to tell the first one is feet must last a lifetime. And there's a great story about this. I lived in Miami for many years, and people that in Florida or who travel to Florida know about the delicacy called the stone crab. And it comes out of the Gulf of Mexico. They trap these crabs, they take off the claw, throw the crab back in, and a miracle, it regrows the claw. You lose your leg, you're not regrowing it. So feet must last a lifetime. The second thing is screening is so critically important because it helps us identify patients' risks. And the third thing is, as I mentioned, preventing the foot ulcer prevents all the sequelae. So the message that I really want to get to everyone who's listening, who not only people with diabetes, but people with prediabetes, because people with prediabetes really are not getting what I feel is appropriate care. Most of the time, doctor says, "Oh, your blood sugars are a little high. You're not quite diabetic yet, so go home and be good."
Can you explain that? Can you explain the two for the audience by chance so they know the
Sure.
difference?
There's a measurement of blood sugar, and it's called the hemoglobin A1C. And that number is the ideal number would be 7. And the hemoglobin A1C is a blood test that is the average of your blood sugars of the previous 3 months. People who are running, right around a little higher, or whose blood sugar, random blood sugar is over 100, um, they're not quite diabetic, but they're on the way. So those people really haven't been given enough education and enough information on prevention. And as a matter of fact, the literature says 21% of those people, when they convert to type 2 diabetes, will already have retinopathy. They'll have problems with their eyes. And 24% of those people will already have issues with sensory neuropathy, where their feet are numb and they don't feel pain. It's called loss of protective sensation for pain. So it's really critical that not only people with diabetes, but people with prediabetes have a comprehensive diabetic foot exam every year. And I'm not just saying it. This is recommended by many groups, including the American Diabetes Association and International Working Group on Diabetic Foot and so forth. And if a person with diabetes is not getting a foot exam, they need to get it. And they need to ask their doctor. And what we say is, if you haven't gotten a foot exam the last time you were there, the next time you go in there, you take your shoes and socks off so that when your doctor comes in, he gets the message. Now, I want to talk for a minute about the doctor for a second,
Yes.
because I don't want people to think I'm trashing the doctor. I'm trashing the doctor a little bit, but there's good reason why. And it goes like this. There aren't enough endocrinologists to take care of people with diabetes. Diabetes is a complex condition that requires a specialist. And the ratio in the United States of endocrinologists to patients with diabetes is about 1 to 5,000. So clearly, very few people with diabetes are able to see an endocrinologist. So by default, 90% of these people are being treated by their primary care provider. Primary care providers are good people. They're working hard and they're getting slammed. And unfortunately, they're generalists and they're not specialists. And it's been proven that they don't know best practices all the time for diabetes. There are also other issues. There's an issue of time. They just don't have enough time to do everything that should be done. There's an issue of education. What do they know about foot health, let alone diabetic foot health? Some are very knowledgeable, a lot are not. So you've got that issue, and then you've got motivation. Do they really want to look at somebody's foot? Usually the answer is no. So I am going to support primary care doctors and nurse practitioners because a lot of them are doing a terrific job, but quite a few of them are not looking at people's feet, and this is something that has to change.
Well, I want to bring up something personal about the pre and diabetic to kind of slingshot me into a question about endocrinology and what you're talking about here. So for all the listeners out there, I have to do a lot of blood work with these genetic tests. And I've got to say, the amount of high A1C and pre-diabetes ratings for myself in people under 30 was staggeringly high. Staggeringly high. And every single person I worked with that had this, I've tried to explain it as best as I could. They would go to the doctors, put them on medication. So what Dr. Mark is talking about here with this stuff is real and happening in real time, and I'm seeing it, right? And people not taking care of themselves the right way. I'm sure my clients never got their feet checked or are not following up with blood work. They're not getting screened. So this is a real big issue that people, this episode take a beat and go down to the copy here. Check out Mark's book on diabetes. Could you flip up the book for us real quick so people can see it?
Thank you.
The 100% Healthy Feet. I highly recommend going to go grab that book on reading it. But the reason I bring up this, I had a specific client that I was working with, and he was 26 years old, didn't look unhealthy at all, but he was on the edge from pre-diabetes to diabetes. Seemed like a normal dude. With this kind of age range of young people having a high pre-diabetes, diabetes, these kind of things. You talk about endocrinologists. Is there a hormone issue going on? Is lack of testosterone or high estrogen? Are those factors in this kind of thing?
Testosterone is the master hormone for men, and so it affects everything. But diabetes is basically the body's inability to use sugars or manufacture. In type 1, they don't either make insulin or don't make enough insulin, and insulin is kind of the key that unlocks the door of the cell that lets the sugar go in so it can be used. I want to mention something else because we're talking about people don't know how bad their A1C is. There's a device on the market. It's called a CGM, a continuous glucose monitor, CGM. And if you've seen anybody that's got this little white kind of gizmo on their arm,
I've seen that.
that's a CGM. And this is revolutionary. And what the CGM does is it monitors your blood glucose in real time. So instead of, a hemoglobin A1C test that is the average of your blood sugars for the last 3 months, the CGM tells you what your blood sugar is today, here, right now. And my wife is type 2 and she wears one. And, it's kind of fun because we eat dinner and then, we wait and it sends a report to your phone.
Yeah.
And so she'll say, well, I wonder if I have this ice cream. I wonder, what'll happen. The thing buzzes. So, but the point here is this. Even people who don't have diabetes are using CGMs now because they're interested in performance.
Metabolics, right?
Yeah. So the really important thing about CGM is it allows the person who's wearing it to have instantaneous feedback about what they're eating and what their activities are and how that affects their blood sugars. And the other thing that's going to be really important about CGMs is one of the two big manufacturers, and I won't give anybody a plug here, but one of the two big manufacturers saves all the data. And the data, for example, let me see if I can say this. The person whose blood sugar kind of goes along like this will have the same reading as a person whose blood sugar goes like this because it's an average, okay? Whose blood sugar goes like this has what's called time out of range. In other words, there's a range where that should be. But if your blood sugar is too high or if it's too low, that's time out of range. And so with these devices, we are now able to understand not only how far out of range you are, but how long you're out of range. And so this is going to do two things. It's going to give people a lot of guilt because the little thing's going to be buzzing a lot. But it's going to also give us an opportunity because we're going to now have information that we can actualize on, that we can, in real time understand what's going on with our blood sugar so that we can, patients can be better about managing, the level of their blood sugars and their medications.
Well, that's where things need to be going is quantitative, right? Hey, listen, what are the numbers? I mean, how often? I mean, even today, if both of us got on social media right now, we'd be inundated with a ton of people like, you got to try the keto diet, and you got to do this workout, and I guarantee for the average, consumer, it's very confusing, and the average diabetes patient, it's all this information is very confusing. Do this and do that when we've really got to follow the numbers.
Yeah, it shouldn't be that confusing because there's just the basic few things. Keep your blood sugars under control. If I give you a list here, keep your blood sugars under control. Inspect your feet every day. Make sure you're wearing appropriate and proper shoes. Moisturize the skin of your feet and legs if they're dry. Big one here: inspect your shoes before you put your feet in them. I once had a lady come in, and I took off her shoe, and her glasses were inside of her shoe, and she had walked on them all day. And when I took them out of the shoe and gave it to her, her response was, "Gee, I'm glad you found them. Now I don't have to buy a new pair."
That's so weak. I'm sorry.
I mean, this is a real story. Anyway, people with diabetes should have a podiatry exam checkup every year. Every year. Smoking is verboten, no smoking. And by the way, I was in Kroger yesterday buying a lotto ticket and happened to look on the wall. A carton of cigarettes now is $96
Holy crap.
in Tennessee. And if you want Camels, it's 100. So those people that are cutting back aren't smoking Camels, they're smoking something else. So anyway, and stay active. That's the last thing. So there are a lot of things that people can do for themselves to, be proactive. The focus on, if I leave one message, the focus here is prevent getting an ulcer because that's the key to staying healthy and living a very, good quality life.
Well, I'd love to add something to that, Doctor. Is really we tend to diversify our investments, right? We have some long term, some short term here and there. I think we should be doing the same thing, health and wellness wise. Is hey, make sure you're getting a good amount of sleep, make sure that you're having enough water, making sure that you're staying, at least moderately active, having a ton of different colors on your plate, so making sure we're having enough micronutrients and those kind of things. Is not just put all your eggs in one basket of just working out or just eating right. Try to get as much as you can spectrum wise to help prevent these things. And you can, if I'm wrong.
No, you're absolutely right. You're absolutely right. There could be an epidemic of health. That would be okay.
I mean, there is. I mean, you work with the VA before, and we're talking about our heroes, men and women that serve for us, and that VA's overrun. We have such a downstream problem with all these things that, like you said, there's very easy ways to prevent a lot of these things if we just take better care of ourselves and do the right things. But it's hard for people to digest, and that's why we have these conversations. Is just to try to help people out.
Well, I think this goes back to the value of certified diabetes educators. I don't think that there's a lot of them in the country, and they do a tremendous service for people with diabetes. But I also believe that they're underutilized, and I think any person who has diabetes that hasn't gotten any decent education about the condition from their primary care provider should seek out a certified diabetes educator. They're a variety of professionals, but they all share the one vision about educating patients, making sure that their blood sugars are under control and they're doing the right thing so that they'll have a healthy life.
Well, you've brought on so much wisdom, a lot of experience on this podcast. I'd love to have you back on and talk even more in depth in this one day. Where can people find you? I'll have all the links for Mark's socials and his book and the copy. But where can the good people find you?
Well, they can find me on LinkedIn. I'm certainly there.
Hey, that works. That's the honestly my preferred mode of communicating for professional wise, Um, but I'll have a link for Mark's book below, his LinkedIn link as well, so you can check him out. I mean, this guy's been at it for a long time and is super knowledgeable. And Mark, I've had such a good time talking with you. Thank you so much for coming on this podcast.
Tripp, I'm grateful for the privilege and thank you.
Of course, you want to thank our sponsors. First off, Beerski Beef Sticks. If you guys are looking for a really healthy snack that's 100% cow and 100% organic and great for the kids, it's no processed meat at all, go to beerski.com, type in code HOWH, Health or High Water Podcast, and get 30% off, I think. 30 or 15% off. I forget, but you'll get a certain discount off of that, as well as thank you Gene Planet Genetic Testing Company. If you guys are looking to get your DNA tested, go to click the premium test under there and click on type in code APT for 30% off the genetic test. So Mark, thank you so much for coming on the podcast. I will be talking to you soon to get you back on for season 5. All right.
Be my pleasure, Tripp.
See you guys. This was Health or High Water.